The role of the medical examiner in the investigation of pediatric death is really the critical piece. The medical examiner is really at the hub of the wheel for a death investigation of a child, because when a death of a child occurs, the answer as to what the cause of death is, and then ultimately, based on that, what the mechanism and manner of death are going to be based on the postmortem investigation. The postmortem investigation always includes at least three things. A complete postmortem investigation always includes at least three things: a complete autopsy, an examination of the scene of death, and a case history review. Central to that whole process is that autopsy. Now, the medical examiner has to work in concert with other members of the death investigation community, because the practice of medicine is based on taking a history and physical. You know, when you go to your doctor, when the doctor comes in and says, "What brings you here?" You know, nobody ever looks at their doctor and says, "Guess," right? We provide a history that allows the doctor to perform a physical examination. In forensic pathology, our patients can't give us the history, and so we are very dependent as forensic pathologists on other members of the death investigation community to provide that to us. Those members may include law enforcement officers, and they may include medical legal death investigators. But we have to work together as a team. Good death investigation is a team sport. We have to work together as a team to put the whole picture together. One of the major components of that whole picture in any death investigation involving a child is the performance of the complete autopsy, and that is always done in good offices by board-certified forensic pathologists. There isn't a defined specialty of pediatric forensic pathology. Having said that, those of us who do forensic pathology and are conscientious in the pediatric area recognize that this is an area that is different from the rest of forensic pathology. When I'm lecturing to law enforcement, I teach them the same thing. I always tell them, you know, working a scene investigation of an infant death is nothing like working the scene investigation in a drive-by shooting. They're just totally different animals. And so you can be the best forensic pathologist in the world for adults, but if you don't recognize that the pediatric area is different, then mistakes can be made. We have to recognize that we're looking for different subtle clues. We often have to take different specimens. We often submit different laboratory tests in pediatric cases compared to the adult cases. I became interested in pediatric forensic issues back actually when I was a sophomore in medical school. In medical school, as sophomores taking sophomore pathology, we were required back then to write a paper on something to do with pathology. And for some reason, even though I didn't really have a strong interest in thinking about going into pediatrics as a specialty, but for some reason I was already interested in what then we always called sudden infant death syndrome. So I actually wrote my sophomore pathology paper on sudden infant death syndrome. So really my interest in pediatric forensics goes all the way back to there.